Hi, my name is Dr. Melissa McCrae, and I'm at Vitality Natural Wellness. We're here today to talk just a little bit about COVID. It seems to be everybody is talking about the coronavirus, so we really wanted to just tell you a little bit about what Vitality is doing to help spread some accurate information and also to really just update people on some support type of therapies that they can do in the meantime. So what is COVID? COVID is a coronavirus. It's a novel virus, which means it's brand new. We've never seen anything like it before. Now, we have seen lots of other types of coronavirus, but this one is a new version of the coronavirus. It originated in China. People talk about there's going to be a pandemic. I wanted to go over what actually a pandemic is with coronavirus. So a pandemic is a global infection spread by one type of virus. The reason you can get pandemics is because typically there's a new virus on the scene that no one's ever seen before, including no one's immune system. So there's rapid spread, and pandemics by definition are also developed from person-to-person contact. So that was the big concern with coronavirus. We have a new virus originating from China that's able to be spread person to person, and we now have a global infection issue called a pandemic. One thing we want to encourage all people to do right now, like this very second, is just take a deep breath. There's so much anxiety going around regarding the coronavirus and all the situations happening, from school closures and business closures. We know there's a lot on everybody's mind, from am I going to get sick? Who is going to get sick? Are we all going to die? So right now, I just want you all to kind of sit back and literally take a deep breath. It's one of the most powerful things you can do to calm your system. So when things start getting tense, that's the first thing to remember, is just take a deep breath. There's a lot of anxiety, again, like we spoke about. There's the news, there's social media. One thing I want everybody to really focus on is there are certain sets of the population that really soak in a lot of this anxiety, and you may not realize it. So please pay particular attention to those who have anxiety disorders or those who already have mental illness or depression even. And also the children. Children are hearing everything. They're hearing the news. They're seeing the social media. They've never experienced anything like this before, and it's something they have absolutely no control over. Schools are being closed, and they're being told they need to learn from home. So as much as adults are feeling anxiety, please keep in mind that the children are listening to everything that's going on around them. And it's important, as our roles as role models and mentors and parents, that we make sure we're creating an environment of security for these kids. So what is Vitality doing? We're really trying to help accommodate as much as we can. And there's some really neat things that we can do that are not typical of a normal office. We've increased our availability of telemed visits. Now, we've always been able to do telemed visits, and oftentimes people utilize those. But we want everyone to know, even if you live close by to the office, please feel free to schedule an either in-person visit or we can do a telemedicine visit. Those visits are set up very similar. We can do them either by phone, but we do like to typically do them by video. So whatever your needs are, we have increased our availability to do that. We also are able to access mobile lab draws. So if you're unable to come in or you don't want to go out into the public, we do work with a lab that can come to your home and check your blood work for you. We've increased our IV therapy appointments. Again, we've been doing IV therapy, and we've known the benefits of nutritional therapy. The research is really incredible. We've been doing that for a long time, but certainly with the current suggestion that IV vitamin C is highly effective in COVID-19, it's really wonderful that we can actually open up some more appointments for that IV therapy. And of course, the other thing is just being available for our patients through our patient portal to send messages. We have lots of information coming out on blogs, coming through our website and social media, so please keep an eye on that as well. As far as COVID-19 goes, let's jump back to that a little bit more. We're going to identify more cases in the coming weeks. With all of the social isolation that is occurring right now, that's an attempt to actually keep the rate of spiking in the virus load to a minimum. So what that means is they expect a huge spike in positive cases over the next 2 weeks. What they're hoping to do is keep that number to a minimum. So it's not so much that we see all of these cases right now. We know that with a pandemic, there's always an acceleration phase. So the goal is to keep that to a minimum so we can also minimize the number of people getting sick. In that regard, it's really important to try to socially isolate yourself, which sounds kind of weird, as much as you can over the next 2 weeks. Enjoy family activities together, enjoy social phone calls and video chats with friends, but just limit your exposure to a lot of people. If we're able to accomplish this, and again, it's never been tried before, we should be able to hopefully make a huge difference in how many people get very, very sick. Out of the cases, we know that up to 16% of people will develop a severe case of COVID-19. Out of those people, the mortality rates are highly varied. And the reason the mortality rates are so varied is you can have a country testing everybody, even if they have no symptoms. They're going to have a lot more positives, and out of those rate, they'll have a certain number of people die. You might have another country only checking a few people, and out of those people, you'll have what seems like an increased rate of death. So we don't have a clear report of mortality rate. We do think that it's going to be similar to influenza. We don't know if it's going to be less or more, but we do feel that it's going to be similar, and we'll just have to wait to see based on the number of people tested and what the death rate actually really is. Questions we're getting at the office. Should I get tested? Well, we can actually do a self-screening of ourselves pretty easily. If you have absolutely no symptoms at all, and if you can pass the test or pass the questions on this brief test on your own, then the answer is probably not. So what kind of things should you answer to determine if you should get tested or not? The first one, have you traveled to an area that has a high incidence of COVID-19? That would be specifically areas like China, Japan, Italy, Iran. So there are some higher incidence areas. If you've traveled to those or had direct exposure and prolonged exposure with someone from those areas, then that's a concern. The second thing would be, have you had close contact with somebody who's been ill with symptoms of COVID-19? So with COVID-19, remember we're focusing on a fever, a dry cough, and shortness of breath or difficulty breathing. It does not have typically a lot of vomiting and diarrhea and head congestion and runny nose. So again, if you're wondering if you should probably get tested and you feel fine, the answer is likely no. If you call the office and you're concerned about where you could even get tested if you are having symptoms, we will help you find the proper testing location. Currently in the state of Ohio, we're going to put you in touch with the local health department and also at the state level. It sounds like Quest will soon be coming up with some testing sites, but at this point, we're working very closely with the local health departments. Let's talk a little bit about a close contact. What is a close contact? Current guidelines are anybody who you've been exposed to for a prolonged period of time that are 6 feet or closer to you. So you're not going to get COVID-19 from the person you pass on the street who's on the other side of the street walking. But if you're in close contact with somebody less than 6 feet, that's what we would consider. Or if you're somebody who's been coughed or sneezed on by someone who has symptoms as well. So who's at risk? This is the group that we're mostly concerned about and why we're really trying to protect these people with our social isolation. Older people. The average age of people who are dying from COVID-19, the average age is 80 years old. So we're really trying to protect those older people. If you know somebody who's going to be more isolated, consider offering to get their groceries for them or maybe providing some food for them. Probably not hanging out and visiting with them, but please be making lots of phone calls because it can be a lonely place if you feel more isolated and by yourself. The next risk group are people who have severe underlying medical conditions. These can be autoimmune disorders, heart disorders, lung disorders, or people who receive medication which suppresses the immune system. So what are our suggestions? If you have absolutely no symptoms at all and you do not feel you're at a high exposure risk, then our goal is really make sure you protect yourself. So we want to wash our hands for at least 20 seconds. So sing the alphabet twice or maybe happy birthday to yourself. But make sure you're washing your hands with nice brisk friction at least 20 seconds. The second thing is don't touch your face. So our mucosal surfaces, that would be like your eyes and your nose and your mouth, the most common places where you're going to get infected. So whatever you do, don't touch your face. The other thing is, if you do start feeling sick or you're not sure exactly what you're dealing with, just stay home. So we really want to protect those around us. We're not going to screen everybody with testing who doesn't feel well. So it's our job right now to really protect others around you. So stay home, continue to wash your hands, do all of those supportive care things that we know about, such as vitamin C and lots of hydration. We know there's wonderful benefits to bone broth and we hear about grandma's chicken soup. Well, there's a reason why that works. If you do start feeling ill or if you have questions about what you should exactly do, please don't hesitate to reach out to us or give us a call. We have lots of recommendations that we use at Vitality, from nutritional supplements and immune boosting supplements to IV therapy or even detoxification. But it's really important that if you are not feeling well, please reach out to your primary care doctor or feel free to reach out to our office. So as a recap, we talked a little bit today about COVID-19, who's at risk, who should get tested, how you should protect yourself, and most importantly, just take a deep breath. This will pass soon and we'll have learned a lot of information. In the meantime, the best thing we can do is protect each other.